All right, so I had my exam already, so I couldn't really review the topics before the exam. The topic is psychiatry, which is something quite easy, I guess. So let's talk about psychiatry now. The first question that someone is probably going to have is, what is the difference between psychiatry and psychology? And from what I understood, psychology is basically the study of the behavioral patterns and the cognitive processes that undergo when someone has a pathological mental disorder. It doesn't really have to be pathological, I guess. It's basically the study of your brain. And the difference between psychiatry is that in psychiatry you are trying to treat these disorders, and yeah, in psychology you study them, in psychiatry you treat them. Now in a psychiatric interview, the main questions that you're going to have to ask don't really rely on just the answers that you get from the patient. The psychiatrist is going to ask you questions about your past medical history, your family history, your past current illness that you would like to have treated, and yeah, stuff like that. So besides that, you also have to look at some of the physical signs that could give you an indication of what the problem is, which these could refer to the speech, the way someone behaves when they enter a room, the way someone's eye movements are, their gaze. You look at a lot of these things to decide if what the patient is saying is true in regards to the involuntary movements or habits that they have. These could also include thought processes, like when a patient starts speaking way too fast or they're jumbling up their ideas. A specific keyword, a specific term that I found was word salad, which refers to when a patient just mixes up everything and doesn't really make sense when they're trying to speak. Okay, so let's move on to the first topic, which is delusions. Delusions is a term that refers to when the patient has beliefs which are false, but they believe them to be absolutely true. There's categories to this. You can have non-bizarre delusions, which are just delusions which are false, but they kind of make sense when someone tells you about them. Like the cops are chasing you, you know. But you also have bizarre delusions, which are the ones where the patient just speaks nonsense, you know. They speak nonsense shit, and it doesn't really make sense. You can also have mood congruent delusions and mood incongruent, and it basically refers to if the emotional state of the patient is congruent with the way the patient is describing their beliefs. Now, two words that I would like to describe are hallucinations and illusions. Now, they fall into the realm of delusions. Hallucinations are the stimulus received by the body, but from an internal source, if that kind of makes sense. And illusions, however, are perceptions that come from an external stimulus. So you hear people talk about hearing voices and stuff, but that doesn't really happen to everyone, you know. So it's coming from an inner stimulus, and that is called the hallucination. The main criterion on the mental disorders that I'm going to talk about are described by DSM is the Diagnostic and Statistical Manual of Mental Disorders, and they categorize the mental disorders based on the symptoms, the duration of the symptoms, and the impact on the person's overall lifestyle. The first disorder in the DSM category that we'll talk about is the delirium. Delirium is defined by the inability of a person to focus, which leads to confusion, leads to disorientation, disorganization, and it can be connected with, because there's confusion, it can be connected to other cognitive deficits like disorientation, speech problems. You can have confusions with memory. Now you can have two types of delirium, which are hyperactive and hypoactive. Hyperactive delirium is when the person has an elevated mood, referring to agitation, whereas the hypoactive delirium is the opposite, where the person has a low mood, referring to just anhedonia and unresponsiveness, if that kind of simplifies it. The delirium cases are also categorized into the causes which lead to delirium. So we have toxic delirium, which comes from the substance-based origin, referring to drugs. Metabolic delirium, which comes from the metabolism of substances in your body, such as vitamin deficiencies. There's also post-operative delirium, which comes from the post operations or post-surgery. The treatment is based on two methods. We have the environmental treatment, and then there's also the pharmacological treatment. Environmentally, we're talking about creating a safe environment for the patient to reduce the symptoms of delirium, like agitation and overall just confusion. Whereas the pharmacological treatment is sort of like a second line treatment where antipsychotics are given to the patient to help them deal with the severe cases of delirium. A brief overview on the substance abuse. We're going to talk about drugs, and we have a lot of substances that can be abused, or they generate dependence on. The key substances are benzodiazepines and barbiturates. Now these are two drugs which are sedative drugs or hypnotic drugs, and they are used in therapy for sedation of patients when they are agitated or they have a higher mood. This refers to anxiety, refers to psychosis, hallucinations, delusions, all these stuff. The difference between these two is that barbiturates are drugs which were used in the older times, but they have been discontinued because they have a risk of respiratory distress, where the muscles in the muscles in the lung can become spastic, or can become, the muscles in the lungs can be relaxed, and therefore the person can just stop breathing, which can lead to coma and even death. The difference between benzodiazepines is that benzodiazepines are a little better at mitigating this risk. However, they are also beginning to produce tolerance and dependence in patients these days, which is why doctors are looking at alternatives.